Okay. Good afternoon, everybody. We can get started. I'd like to welcome you all to today's session, which is titled Milestones and Challenges in Tackling AMR. I believe we have a video that is about to roll before we get into the conversation.
Dear Minister Lauterbach, distinguished speakers, esteemed guests, I am thankful for the invitation to address this important summit, and I regret that I cannot be with you in person today. Antimicrobial resistance remains a critical global health challenge, with nearly 5 million deaths associated to it in 2019 alone. Therefore, we have identified this issue as one of the 3 priorities to be addressed during our current G7 presidency. Our main focus has been on accelerating research and development of new antimicrobials and on improving access to diagnostics, vaccines, and treatments. Special attention has been given to Africa, which faces the highest mortality rates from AMR. Strengthening the continent's health systems and pharmaceutical manufacturing capacity aligns with Italy's Mattei Plan for Africa, contributing to sustainable development and enhancing pandemic preparedness and response globally. Timely access to effective antibiotics is essential for global health security. However, the development pipeline for new antimicrobials remains insufficient due to the market failures. We urgently need to guarantee sustainability for antimicrobials that fosters innovation and ensures equitable access, sustainability, and effective stewardship. In 2023, a UN General Assembly resolution emphasized the need for a multi-sectoral One Health approach, integrating human, animal, and environment health. This requires collaboration across agriculture, finance, research, and education to mount a coordinated and comprehensive response to AMR. Additionally, supporting national AMR action plans with adequate resources, robust infection prevention and control strategies, and strengthened diagnostic capabilities is crucial. IPC measures and vaccination campaigns are vital for improving patient safety and treatment outcomes. Finally, enforcing IPC programs in healthcare facilities and securing sustainable financing through national and international channels are essential for effective AMR action. Let us continue to work together with urgency and dedication to address AMR and safeguard global health. I look forward to the progress we will achieve all together. Thank you.
Thank you so much to the Italian Honorable Minister of Health, Professor Dr. Orazio Chisali, for his remarks. Unfortunately, he couldn't be here today in person to join us. Even though that video was meant to come later, but I think we can also just, get started. My name is Latifat Okara, and I'm the Principal and America's Regional Lead for our Health Policy and Insights at Economist Impact, the research and think tank arm of the Economist Group. And it is my absolute pleasure to moderate this keynote session today on a topic that is very timely. AMR remains a growing and concerning global challenge, responsible for over 1 million deaths globally. We've tried raising the alarm about the importance of this, of AMR, with terrifying statistics and compelling economic arguments, including the most recent World Bank estimates that shows that AMR could result in $1 trillion in additional healthcare costs by 2050, and between $1 to $3 million trillion loss in GDP by 2030, which is only 6 years from now. Yet for the longest time, AMR has been overshadowed by other priorities: climate change, the infectious disease outbreaks, and geopolitical tensions. If I were to ask one question before this year's UN General Assembly, It would have been, what more do we need to do? What more do we need to show that this is really a pressing challenge? What more do we need to do in order to secure the commitment and action that AMR so desperately needs? However, in the wake of the UN General Assembly meeting on AMR a few weeks ago in New York, we have reasons to trust that the fight against AMR is heading in the right direction. So now I no longer have a question of what, my question is how. How do we achieve this UN declaration? The UNGA declaration outlines critical targets, including a 10% reduction in global AMR deaths by 2030, and a decrease in antibiotic use within the agricultural food sector. My question is, how do we get there? Today's discussion will be underpinned by 4 practical questions. How can we, as global health leaders, build on this momentum to stimulate practical action to realize these goals? Secondly, how can we ensure that we do not find ourselves in an implementation crisis in a few years' time? Where are the best practices, and how can we learn from them? You know, the good news is that I'm pleased to say that we have the right people in the room today who can provide answers to those questions. Today's discussion is divided into 2 panels. The political panel, which will take up the first half of today's session, and we're also very privileged to have an intersectoral panel of leaders who can share and bring together policy and systems perspectives in achieving AMR ambitions and targets. Our dynamic keynote speakers will explore key milestones and also challenges in understanding, preventing, and managing AMR. They'll talk to us about what the flip side also looks like. What are the challenges that remain, including the slow pace of new drug development, inadequate regulatory frameworks, and the need for global coordination. With that said, I would like to introduce and welcome our first panelist, Professor Dame Sally Davies. Welcome, UK Special Envoy on Antimicrobial Resistance. And next, we have Dr. Katerina Bome, Assistant Director General, External Relations at the WHO. Dr. Abdullah Aguizani, CEO, Public Health Authority, Saudi Arabia. Engineer Christina Vatome, Secretary of State for Health Management, Portugal. Welcome. And last but not least, Dr. Muna Abusin, Ambassador on Antimicrobial Resistance from the Federal Ministry of Health, Germany. So we have a good group of people. Welcome, and thank you for your time. To start us off, I would like to build on my opening remarks and also the comment from the Honorable Minister of Italy. Last month, we experienced a milestone for AMR, the approval of the political declaration on AMR during the UNGA high-level meeting in New York. One of the key commitments at that event was the establishment of the independent panel on evidence for action on AMR, a recommendation that was made in 2019 by the Interagency Coordination Group. Dame Sally, from your perspective, what are the key ingredients that are required in setting this up? What does this mean, and how can we make a difference in the near future?
Thank you. I'm absolutely thrilled that you trust everything's going to happen. I'm still at the hoping stage, I want to say. But I'm more hopeful than I've been in many years because, and I think we should give a real shout out to it, multilateralism has worked to get a really strong document. And I think we should be cheered by that. It's better than we expected. It recognizes how affected the low and middle income countries are, who bears, and they bear the burden. It recognizes the role of conflict in increasing the burden and the need for action. If it sits in the library at the UN, it's not going to do anything. So your questions are all about how do we move forward, and that mandate for an independent panel is very important. And we're going to have to design this very carefully. I think we need to start by what it isn't. And it's not going to be telling member states what to do. Mm-hmm. It's not going to assess individual country performances. It's not going to be an accountability mechanism or have enforcement mechanisms. And I say that very strongly because during the negotiations, those were the points that people who didn't want a panel made repeatedly. And we have to honour that as we go through to organise it. We actually believe very strongly that it has to be a panel that sits in the Global South and takes the Global South with us, is truly independent scientifically, truly One Health, and so our government has said they would like to see it as run by the quadripartite but hosted by UNEP in Nairobi. Because if we don't get in the environmental and animal aspects, where today most of us are talking about human health, then come a few years' time, we will regret it and we will have missed the boat. But as we do it, we've got to strengthen the quadripartite who have got to consult, I hope, with the support of the Global Leaders Group on how to do it. And I think we need to consult on the scope, the positioning, the different models, the appointment of scientists, and then who sets the questions and who receives the answers. And I hope we can cut it into small chunks and do it very quickly and rhythmically so we get some answers from member states so we can move forward and set it up. It can be a light for us all to watch, to support everyone from the poorest to the richest.
That's fantastic. Thank you for the opening remarks. And Katharina, if I may just turn to you as well, given that you lead the WHO's efforts in multilateral and multi-sectoral partnerships for advancing global health initiatives, and also recognizing that you've also been very actively involved in moving forward and improving access to diagnosis for more than 100 million people in your previous life in low and middle income countries, including tackling major emerging challenges, including antimicrobial resistance being one of the key ones. Tell us a little bit about how you see the realization of the interagency coordination group coming into fruition.
Yeah, thank you so much. You know, I lost a family member of a drug resistant as a result of sepsis earlier this year. And so that showed me that it's not a distant threat, but it's really real and it's in our day-to-day lives. And I feel that often gets forgotten. And what we've seen at WHO is, you know, paper is patient. And we've written a lot about AMR, but when you really look closely, not so much has happened and not so much has been done. You know, only 11% of countries with national action plans actually have a dedicated budget to implement these action plans for antimicrobial resistance. We at WHO basically cannot pay our salaries for our AMR teams as of next month. So I feel that the urgency of this threat cannot be overstated and yet is often not recognized. That's why I was really grateful for the high-level meeting, and I fully agree with Sally that it's a success for multilateralism. It's one of the strongest declarations I've ever see out of the UN General Assembly. And I do think that the independent panel can and will make a difference. You know, it will be able to tell us what works, what doesn't work, and it enables countries to see what now is a very fragmented evidence field, to basically pick out the pearls and run with that. So to your question, what does this panel need to be successful? I do think it needs to be independent, it needs to be neutral, right? That's very important. It needs to be set up, be diverse enough, have country representation from all, from rich and poor and all levels. It needs to span public, private, and civil society. And as Sally said, it needs to be multi-sectorial. I also feel, last not least, and Sally, you said this, it needs to be closely linked to the quadripartite organizations, because otherwise we'll end up with something that's yet another vehicle that leads to a yet even bigger fragmentation. But so in summary, I think it's renewed our energy, our efforts to fight AMR, which is something we need to do here and now and not in the future.
Fantastic. Thank you also for sharing that very personal story with us. I think it's important to always, when we think about AMR and how people can relate with AMR, I think it's important to always add that human side to it and personalize AMR. So thank you for sharing that example. If I may just go to Dr. Aguizani. Next month, it's a big month for the Kingdom of Saudi Arabia. The Kingdom of Saudi Arabia will be hosting the 4th Global High-Level Ministerial Conference on AMR with a clear direction of what you are about to do, from declaration to implementation, accelerating actions through multi-sectoral partnerships for the containment of AMR. Tell us a little bit about that. What are the plans to enable these multi-sectoral partnerships? And also, what are the plans to move from declaration to implementation?
Oh, thank you. Thank you, Latifat, for the invitation, and thank you for Federal Ministry of Health of Germany for invitation and organizing such lovely events. Saudi Arabia, since the topic of AMR has been brought to the global agenda, was one of the major supporters of bringing AMR in the global agenda. We recognize that AMR is existential threat to the modern medicine that we are enjoying. We recognize that there is the modern medicine, the fundamental care of medical care that we are enjoying. These days are at risk due to the AMR or antimicrobial resistance. So that major topic that is threatening our modern medicine, we're recognizing that it's hardly put in the political agenda. And for that, since our enrollment or our part of the G20, we put AMR as a part of priority in the political agenda. During our presidency of the G20 2020, we put AMR as a priority, and since then we hosted a series of events, organize side events, and co-host major events where we support, organize, and endorse antimicrobial resistance as a major public health threat and to be part of the political agenda. So that's what was one of the major rationale for us to call for the Jeddah Summit or Jeddah Conference in 2024, next month, 15 to 16 November. We took the high-level commitment in United Nations in a very coordination and very cornerstone of our action. We will be announcing concrete, practical steps toward tackling AMR. We will be announcing the Learning Hub, which is basically work on translating the knowledge to wider scope of the country. The myriad of ignorance of AMR is huge, and we need to make sure that each healthcare worker also and beyond the healthcare worker is also have the chance to know and knowledge and understand how to tackle antimicrobial resistance. Also help country also to learn from each other, and we learn from them as well, and how we translate and conduct national action plan in a very coherent and protective way. Also, we are announcing the logistic hub, which will help finding a way of securing the necessary antibiotic and vaccine, finding an innovative mechanism, or learn also from the existing mechanism of procurement and also supporting strategic vaccines and antimicrobial. And rest of another step that we'll think, and we are sure that will be a major step toward tackling AMR. Thank you.
Thank you. Thank you for sharing that. Engineer Christina, in Portugal, the national plan to fight antimicrobial resistance, based on a One Health approach, has made significant strides in addressing AMR by recognizing the interconnectedness between human, animal, and environmental health. Tell us a little bit about the successes and also what are some of the challenges that you've seen as a country in implementation, and how is that currently being overcome?
Thank you. And thank you for having me here, and also thank you to the Ministry of Health of Germany for the invitation. I would say that probably we could call ourselves a case of success in that area. So we are already working in a One Health perspective, together with the Directorate of Animal Health, with the Environment and Agriculture, and also Health, Human Health. And we have a very high rate of vaccination in Portugal, so people trust, using the theme of this summit. People in Portugal trust in science. People trust in health professionals, which is good. So we believe that we are in the right path, but we also know that we have aging society, and this brings more concern regarding the AMR, namely on the long-term care facilities we have, where people live or stay because they have to stay there to take care of their health. And in those situations, we have to focus and we have to implement policies that will keep the success that we are having at the national level. And also, we also are aware that we have to go further on the cooperation, on the national cooperation, and we are developing a plan and a strategy to go further than our borders and the national level, so to be more present at the regional level.
That's great. Thank you for sharing all those very wonderful things. One of the things that you said is that in Portugal, people trust the healthcare system, healthcare professionals. Tell us a little bit about how that, because I feel like trust is something that is constantly evolving and it's changing from country to country. So it's impressive that we can boldly say that. So can you share what are some of the best practices that you've seen, and how can maybe some of us from this room also take that learnings as well into our own different spaces?
That's a good question. Probably it's a cultural topic. So the experience that people have with the NHS and also with the public health service, private health service, and also with the social service is very good. I don't know if it will keep in the future, but our role as government is to maintain and to support the trust people have on these services. And for instance, we just were having a conversation before joining this panel that people above 65 years old in Portugal have a rate higher than 70% of influenza vaccine. So, which means that people still trust on the NHS or on the health service, and also on the science. So we want to keep it like that. So I don't have a recipe, but
great.
It's probably a cultural situation topic.
Thank you. Thank you for sharing. What a wonderful example. Still on the topic of AMR and One Health synergy, Dr. Muna, I wanted to turn to you. I know one of the key challenges that is often highlighted when we talk about One Health and AMR is frequently, it's really about funding and implementation of the One Health's National Action Plan on AMR, particularly in low and middle income countries. The Multi-Partner Trust Fund on AMR has been positioned prominently in the political declaration as central to reaching the target of 60% of countries having funded national action plans by 2030. From your perspective, what is needed and how do we reach that global target? what challenges remain regarding scaling and aligning AMR initiatives with One Health frameworks?
Thank you. Okay, I tried that. My voice is carrying that as well. Several challenges in this quite complex question. Funding, always a challenge. I think we could start and end any conversation on global health with that. You also mentioned the One Health approach. We have a concept and a framework, and we all agree on the interdependency of the human, animal, agri-food, and environmental sector. But we should not forget to do our specific homework in each sector as well in this context. Antimicrobial resistance, sometimes it helps to disentangle some of the challenges when we have the overarching goal in mind. And this refers back to the Global Action Plan on Antimicrobial Resistance from 2015. The ultimate goal, or the overarching goal of the Global Action Plan, that was and is still to ensure for as long as possible continuity of successful treatment and prevention of infectious diseases with effective and safe medicines that are quality assured, used in a responsible way, and accessible to all who need them. And also this year's The Lancet series from May 2024 made again this reference with the title and the theme, The Need for Sustainable Access to Effective Antibiotics. So if we further unpack the challenges around these questions, we come to the real ones remaining, and the conversations are and have been around that. How do we get things actually done on the ground? Who has the ownership in that? How do we prioritize? Where comes funding from? And last but not least, do we make and see a difference? How do we measure impact and progress? So around funding, Germany welcomes the central role of the NAP implementation addressed in the AMR political declaration, and would also welcome broader donor base for the AMR Multi-Partner Trust Fund, which was one of the outcomes of the second ministerial meeting in the Netherlands in 2019, but has to be seen really as a catalyzing AMR activities in a One Health context, particularly in low and middle income countries. But it's one instrument, and neither the AMR Multi-Partner Trust Fund nor the mentioned $100 million in the declaration will be sufficient to reach the target. It can be really only seen as a catalytic funding. Some of the obstacles and challenges with funding and around AMR remains. AMR is not a disease nor a syndrome. And the former ADG on antimicrobial resistance and now regional director of AMR, Hanan Balki, in reference to her, described it as a phenomenon. In the past and up to now, we have seen often disease-specific programs in the health landscape with a vertical programmatic approach, such as, for example, for HIV, AIDS, tuberculosis, and malaria. And we have to admit, they seem so often to be more successful so far in resource mobilization and funding. However, antimicrobial resistance and also infection prevention and control, including safe access to safe water, sanitation, hygiene, and vaccination, are cross-cutting public health priorities, which require a more strategic operational alignment across health, agri-food systems, and the environment. So it is about system transformation and strengthening in the broader sense, which makes it sometimes challenging really to acquire the adequate funding. But we should really keep in mind that antimicrobial should never be used as a quick fix for weak systems. And as we shift from a more vertical to more horizontal structures and from fragmentation in the health landscape, we also need to see how this shift can be reflected in the funding landscape. Germany welcomes that the Ungar political declaration requests the Partei Joint Secretariat on AMR to map the funding landscape as a first step, but further action and coordination will be needed to increase transparency and leverage these resources for better accessibility for countries according to their identified priorities. I will stop here.
Okay, great, thank you. We're going to turn to the audience for some Q&A, because I recognize that we'll need to wrap up the first panel session very quickly. But before that, I had a quick question, especially given that the recent Lancet report on AMR, and also just recognizing the UNGA political declaration that shows that infection prevention and control, better hygiene and sanitation, and vaccination have been stressed as priority areas for implementing national action plans. Maybe Dame Sally, if you want to share with us your opinion on the next steps to achieve this, maybe a concrete example that you want to share.
I think an even better example is the Lancet paper that came out the week before the UNGA declaration on the global burden of disease. And it showed that in children aged under 5, since 1990, we'd had a 59% reduction in deaths from AMR. And that's because infections have gone down. Why have infections gone down across the world? Because of WASH, clean water, sanitation, IPC, and vaccines. So we know it can work. So now we have to do it everywhere for all healthcare facilities across the whole world, leaving no one out. And then we'll reduce infections, we'll need antibiotics less, and we'll have less AMR. Will that do as a good example?
Fantastic examples. Thank you very much for sharing that. Katharina, do you want to add to that? Yes, please go ahead and clap.
Yeah, as I said earlier, for WHO, the focus will be on implementation and working with countries. And as you said earlier, Christina, it's about working on a people-centered approach from diagnosis to good care and treatment, but also prevention. And we at WHO just published a report earlier this week that builds very much on what Sally said, which basically shows that if we used our vaccines well, we could save 2.5 billion doses of antibiotics every year and save a third of the hospital costs associated with antimicrobial resistance. So I think that's a very powerful example, yet again, that especially in dire times, economically wise, we have to maximize efficiencies and basically use the tools we have and use them well.
That's a very important point. Does anybody else want to add to that? Okay, I think.
Yeah, probably the infection control and practices is the most quick approach to fix the antimicrobial resistance. And the result that you can find, it will be very fast. You have an infection, you do the infection control practices, you cut the chain of infection, and then no longer they have resistance. So I think building an infection control practices is important, and there is a room, huge room for it, for country they can adapt and implement. And also stewardship, implementing the infection control practices within the animal sector is no longer less than the human health. And also, people talk a lot about the financing, and it's important that we have the financing, but also there is a way of finding solution for AMR, and one of them is diagnostic. It does not require all the complexity, I would say, of finding a new antibiotic. And I wish, as a practitioner, one day I would have a test that show me that treat or not treat. As I'd say to my colleague, that would be a dream investigation. As a 2-line treat, 1-line no treat. So I hope to have this one day. Thank you.
Thank you so much. So we have time to take like 1 or 2 questions from the audience. Oh yeah. Sorry.
Can I add something?
Yes, please.
I would say, apart from all the topics that are mentioned on the political declaration signed on the past September, I would say communication. We have to work and speak to the people, and for different ages, different cultures, because if people, the citizens, are not engaged and don't understand why we need to fight AMR resistance, they will not trust. Yeah. And we can use any kind of content, so we can use the shows, we can use the media, we can use the news, we can use different languages. I know that I was in a previous event that we have to speak the same language, but in this case we have to speak the language people understand. And the people at different ages. So communication, communication, communication. Otherwise, we will stick to the political approach, to the professional approach. But then the citizens, the ones that are going to engage in this, that they will implement in the field all the protection that we want and adhere to the prevention will not have success.
I agree with that. I think communication is key. Speaking a language that both politicians, academia, and the general population understand, I think that's really important. And also just putting that human side to AMR as well. So thank you for bringing it up. Do you have anything else to add before I turn it up to the audience?
Yeah, I mean, we have the global figures, we have the global data, we have the global economic case. We really need to break that down to the national level, to the local level, facility level, to community level, as mentioned. They really have to have the ownership, otherwise we will not succeed.
Thank you. So we have a question from the audience here. Yeah, we'll take turns. So I see 3 hands, so 1, 2, 3, and then we'll take all 3 questions before the...
I'm Dr. Aditya. I'm an adult vaccination specialist, and we run ICU. In ICU, we have the antibody resistance panel. We have a local governance panel. I want to know from the experts from you, what should be the guidelines and what should be the member panels? How frequently we should have the meetings, and what could be the limitation, what could be the strength of a local antibiotic resistance panel, because everything starts locally, then it goes state, then it goes national, then it goes international. So I want the expert opinion, like how should be a local governance body should have an antibiotic resistance panel. Thank you.
Thank you. There's another question from the front here. No?
Thank you. Well, if we look at the list of the top 10 threats, global threats for health of the WHO, antimicrobial resistance is on the 5th position, and the vaccine hesitancy is on the 8th position. So I would like to echo what Catherine and Christina said, because there is a link between both situations, and I will add that we are living in an aging world. I'm a very good example of that. And so I think it's very important to have a focus on lifelong immunization, because the majority of the national programs of vaccination are very, very good, very strong for the pediatric ages, and then they lose power with the aging population. So I think it's very important to have a lifelong immunization, because we are living much more and we want to live much more in a healthier world.
We have a question from the 3rd row there. Thank you.
Thank you. Casimiro Vizzini from the One Sustainable Health for All Foundation. I've heard the word communication, I'm grateful for this, but there was a word missing, education. Doctors are not aware about resistance. Just a simple example, since years we know that azithromycin is creating resistance against chlamydia, but I see many patients with chlamydia and azithromycin. And it's years that we know that we should use doxycycline. And this is something, a tiny example of what is happening. Doctors don't know, general practitioners have no idea. They are not up to date. Thank you.
Thank you. So, you want to start?
So they're all right, aren't they? We need vaccination programs that work for children, for adults, and the elderly. Look at the new data, which shows that the rate of AMR and deaths is rising over 70. Please look at it. I think for local antibiograms, you need your experts within the country to make it up, but I think one of the great things the WHO does is the technical guidance. So I would look to the WHO for supporting you on that. We do have lots of technical know-how. The big question is, how do we put it into practice? In many countries, when there aren't enough doctors, there aren't enough nurses or pharmacists, that you can buy these things, not always of proper quality, over the counter. So we have to look at what it's like in those countries, in those places, and help find the funding for the national action plans that will sort those problems out.
Fantastic. Anybody else from the...
I think I agree with all the comment that has been addressed by our guest here, and I think it's emphasized important of show the room that there is a room for action even in granular level. So even in your unit, there are a room of improvement, and I'm still optimistic. I think we should, all of us, if have a take-home message that we need to work in our capacity, in any granular level. So, and your question with how many time of meetings you do, it's basically on the need. If you need to meet every week, I would recommend that until you establish your unit in the right track, and then you find it more frequent. So I think there is a room in each of us, in each capacity, to educate, to work with his stakeholder, to light a candle and move on to tackle AMR in your community and ultimately to the globe. Thank you.
Mona, please.
And particularly coming back to the health professionals, which are educated or not educated, but really also for the committee, bring it beyond the AMR community. Really, it is not only tackling infectious diseases, it's really about an aging population, we heard, it is about cancer treatment, which won't working if we don't have antibiotics, all the successes we see within the ICU, medicine, surgery, just to name maternal and child health. We really bring this conversation beyond the AMR community, and we have in the past confined our discussions too long among this context.
Thank you. I think we have time for one pressing question. So if you have one question that you must ask before you leave this room, I see one hand over there, so please take the floor. Okay.
Yes, thank you very much. This is Ayman Hadi, Research Associate in Global Health with Akon University in Berlin. So I see that what we are talking about is one end of the equation, that is health workers, infection prevention, control and everything. But what about the other side of the equation, that's the pharmaceutical industries? It has been a lot of research done in the disposal of those antibiotics and the effects in the environment, because a lot of water resources has been contaminated with those antibiotics and goes into animals. This brings us again to the One Health problem. So is there any policies that should be done to also put the pharmaceutical industries, who we are waiting for the solutions from, actually for new antibiotics, but also to stop the contamination? Thank you very much.
So the pharmaceutical industry do recognise that, says me from the public sector. We now have an ISO standard, a kite mark done by the British Standards Institute that's global. 14 manufacturing plants have been kite marked so far, and there's about 60 lined up wanting to be kite marked. And it is exactly this. How do we make sure that our pharmaceutical industry are making drugs we need, but not contaminating the environment and the water supplies? It's very important that we look at that. We look at sewage. We look at the role of plastics and biofilms with AMR. There's a lot of work to do, but it's started.
Thank you. Anybody else wants to add to that? No? Okay, good. I think this wraps up our first panel. I would just like to say a big thank you to everyone for your time. Thank you very much. Thank you. Thank you. Thank you so much. The second panel. So I just wanted to make sure that people know that we still have the second panel. So please don't leave the room just yet. The second panel, I would introduce them now. Dr. Joanne Rotigan, the CEO of Wellcome Trust. Thank you for joining us today, sir. We have Dr. David Reddy, the Director General of the International Federation of Pharmaceutical Manufacturers and Associations, IFPMA. Thank you for joining. And we have Dr. Ashley Moodley, the AMR Hub Lead at SIGA. Thank you for joining us today. The second panel, this intersectoral panel, thank you so much for all the experience that is seated in this room right here. And it's really going to reflect on where have we been in the past, the past couple of years as it relates to AMR and tackling AMR, and where are we going in the next couple of years. And we'll also be bringing in that intersectoral conversation, which I think we've heard from the first panel, the importance of taking a multi-sectoral approach in tackling AMR. So thank you for your time. I'm going to start with Joanne. Is that okay to call you that?
Jon Arne.
Jon Arne, okay, thank you. Last month, we experienced a milestone, the approval of the political declaration. We've talked about that a little bit, but from your perspective, and also just recognizing that Wellcome, just recently, leading up to the UN General Assembly, Wellcome Trust had released a policy brief that identifies opportunities to drive change in how governments respond collaboratively to antimicrobial resistance. And at the core of the brief is really the desire to support discussions with and between governments on how to move from declaration to implementation. So if you can please share with us, what are some of the factors that are needed to ensure successful implementation? What would you say are some of the key ingredients needed to make a difference in the near future?
Well, thank you. And some of you may not know Wellcome. So we are a large foundation funding health research to really improve lives around the world, lives for everyone. We have been engaged in what we used to call drug resistance infections, many acronyms in this space. And now we all call it AMR. I think we should probably even call it something that actually relates to people, because that's key. We are a research funder, so we have in particular been, of course, focused on the antibiotic pipeline. How do we make sure that we do generate new antibiotics in public-private partnerships? So we are proud to have been a part of that discourse and actually funding research for many years. And then also funding all the broad research and evidence need that is necessary for what we just heard from the previous panel, and I won't report back on that. But in addition, we are doing policy influencing work. So we definitely have put a high emphasis on how we can have an impact on the policy discussions. We are a foundation, independent, so we definitely understand that member states need to drive those discussions, but they may now and then also need help. So to us, we are very pleased with the high-level meeting declaration, better than expected. You call this an intersectorial panel. I guess I'm on the human health side, so I am biased. I am a physician. I have a health background. But we believe that multi-sectorial approach that is sort of going through the declaration is really key. The scientific panel is really important. And I think because it's easy to agree in a room like this, and it's easy to agree. But we should also say, even though I said the declaration was positive, it also didn't achieve agreement on things that I, from my professional background and evidence sort of base, would say should have been agreed. Mm-hmm. And that speaks to the interests and the trade-offs between different sectors, also on an issue like infection prevention and control and the use of antibiotics. And it speaks to agri-food businesses versus human health. And that's why we believe a science panel is important. So it's not only about making sure that the evidence base is useful for National Action Plan and those platforms, but actually also useful for guiding decisions. And there are trade-offs to be made. We are really supportive of the fact that the quadripartite will take a lead together to make sure that the scientific panel is established. It needs to be an inclusive process in doing so. We need to listen to scientists, needs to listen to to civil society, to industry and other actors in that process. But we also need to make sure that that panel, even though hosted by the quadripartite, it can actually challenge the quadripartite, because my concern is that in the end, a quadripartite can never do more than is the least common denominator. And I just talked about the UN General Assembly or the high-level meeting not agreeing ambitious enough targets and including, I should say, on the food sector. And that means we need authoritative evidence with scientists working in the human sector and in the animal sector that can come together and actually give us that evidence base and give guidance. We have that in the climate sector. We have IPCC. We know how difficult that is, and we know how contested the climate space is. But still, we have a collective international evidence base. So we are really pleased with that. But just make sure it needs to be independent, it needs to be robust, it needs to have the sufficient sort of solidity and authority on decision making. And that's often difficult. And then we need to make sure that we deliver now on the commitments in the declaration. Declarations are long. It's hard to identify the real material commitments that have been made. But we need them to come together. It's so great that we will come to Jeddah in the ministerial meeting just a month forward. But that should be a start. It should be a start of both countries and governments coming together, but also actually the multi-stakeholder partnership platform coming together across sectors to make sure that we are keeping ourselves accountable. And then finally, accountable to what? We need targets. Yes, I talked about we need narratives and understanding of the problem. We also need quantitative targets. We have the 10% reduction in burden of an AMR-related mortality. That's great, but we need even more ambitious targets and targets that are easy to see. So we have a lot to do, even though we have a good platform.
That's a very good point. Thank you for bringing that up. Ashley, I'm going to come to you now, because I know you wear multiple hats, both at SIGA and in academia. And some of the work that you do centers on optimizing antimicrobial use in different livestock and value chain. And so really bringing in the animal health perspective, understanding the mechanisms that drive selection and spread of AMR, and developing targeted interventions for smallholder farming systems in low and middle income countries. So tell us a little bit about some of these efforts and how they've been able to reframe and communicate antimicrobial resistance more tangibly and broaden the dialogue beyond AMR community.
Thank you very much. So I guess a lot of you don't know what CGIAR is, and if you don't know, it's a global partnership of various research centers based in the global south addressing poverty and food insecurity through agriculture. And specifically, I work for the International Livestock Research Institute, and so I feel like the odd one out, not only on this panel, but in this particular summit. And basically, before I get to your question, I just wanted to say something that I hadn't heard about IPR, and it's about data transparency. And I think in a lot of places, what I haven't heard is that the open sharing of data. We have data. There's some places we don't have data. And I think what's really important is to be able to share that data that is so needed for that evidence synthesis that IPO would need to have. And so there needs to be this thinking about data sharing. And a lot of the times it's because of a reluctance to share as the perception of how one country may see themselves in the global space. But coming back to reframing AMR, I've been working on this topic for more than 20 years now, and I'm starting to get gray as well, not because of AMR, hopefully, just as age. And so I think for me, it's been really difficult. I'm a microbiologist. I understand AMR in so many different ways, and I find it hard to communicate about AMR to just my mom and dad, or my friends. And so I think a lot of us understand AMR in this room and maybe in the more technical rooms, more scientific rooms. And unfortunately, we need to be able to communicate that with the people who need to change that behavior. And for me, it's a smallholder farmer outside of Nairobi. I need to be able to tell him or her why they should not use antimicrobials and the importance of not using that. And I think that that's really, really crucial. And so this is where I think context is incredibly important. We heard about that today, talking a lot about context, relevant solutions, interventions. But I think very, very importantly, context also means culture and social norms, and that drives a lot of the behavior that we see in people. And for me, and where the institution that I work for, livestock, it's the understanding that livestock is important. It's an integral part of society. And just in the session before us, there was somebody who brought up something about animals. And I want to point out that it's really important to understand that livestock is part of the solution. It is not only the problem is also human use. And we don't talk enough about that. And so I feel I have to defend my sector because we are making enormous strides in reduction of use. The question is whether that has any impact in human health. I think the jury is still out on that. So yes, we need antibiotics for animals. Animals are part, for not only for production, but for food. And in many parts of the world, they are part, just a glass of milk or an egg a day is so important to prevent malnutrition in vulnerable populations. It's not about access. We sit here in Germany, and I think here in Germany, you're eating about 54 kilos of meat per person per year. And in Kenya, where was my other home, it's something like 10 to 15 kilos. So it's really not about access in that way. And the last thing I wanted to point out is that it's about language. And we spoke earlier, the panel before us spoke about language. So in Kiswahili, there's no word for antibiotic. So we really struggle to having to communicate in a layman's term without having a word that we can use. So we use dawa, and dawa means everything. It means medicine. So it covers vaccination, vitamins. So now how do I tell a farmer about dawa and not using this dawa, but they can use another one? And I think that that's really important that we don't have the right words to use in this case. So we need to find a language that is relatable, it's understandable to whoever it is that we're speaking to. And that has to resonate with that particular person. Because very often the behavior that we see is driven by the environment in which this person is making decisions. And very often the choice to use an antimicrobial in animals is because they may not have another choice. And so I think we really need to address that, not technically, but a human-centered approach to really understanding those problems and coming up with solutions. So thank you.
Thank you. I really like the point that you made there, so thank you. Finding the right language is key. We've heard that several times throughout the panel. Can I just quickly ask you, what are some opportunities that you see that we can leverage to ensure that we are bridging that gap and ensuring that language is specific, right? It has to be specific and context specific to the people you're talking to the environment, to the culture. What are some opportunities that we can leverage?
I think one of the things that I leverage with the work that we're doing, because AMR is a topic that's very new for in a lot of the regions and communities that we're working in, but when we talk about food safety and zoonoses, that has been there for a long time. So we're leveraging those partnerships, those relationships, that trust that has been built as an organization which has been based almost 50 years now in the Global South. So we're utilizing that, and we spoke about trust yesterday, and I think today that is really important. And at the moment in the country in Kenya, for example, trust in government is very low. And so how then do we use, so we're utilizing those existing partnerships and adding on AMR into our existing work. And I think that that's the cost benefit. It's not about an AMR training. No, it's a training about how do we raise our animals and how can we use vaccinations better and how do we access animal health services. So it's about building it into existing programs, I think is one of the key. It's not to say AMR is not important and doesn't deserve its own space, but I think in these cases, in these instances where we don't have
from a lack of access to antibiotics than from drug-resistant infection. So we have to tackle AMR and also access to antibiotics simultaneously. Sustainable access to antimicrobials has been identified as a persistent challenge. What is your reflection on the last couple of years since the last high-level meeting on AMR? What did we learn and do? Where are we now? And how do we best balance different needs and priorities in different regions and settings, just considering the current challenges?
Thank you. It's a really good question. In terms of, if you look at what's been achieved, I think First of all, there's political will and a recognition of the problem. And I think the declaration was a major step forward to where we need to be. The next element is that this is a multi-sectoral endeavour. So everybody has a role to play, including the private sector in this, in both facilitating the discovery and development of new antimicrobial agents, but then also in facilitating access. You know, one of my colleagues, my previous colleagues at MMV used to say that, you know, these products you're developing, they don't turn into medicines until patients can actually take them. And that's something that we need to keep at the core of what we do. So if we start at the beginning, where are we on innovation? So I think that over the last few years, there's been some really good initiatives put in place, such as CarbX. I think the AMR Industry Alliance has been good, and it's given rise to the AMR Action Fund. Now, this is a fund of $1 billion. 20 companies are contributing to that, including also the Wellcome, Novo, and Boehringer Foundations. And WHO is adding technical support. So what you're seeing there again is different partners all coming to the table on this. Just with regard, the AMR Action Fund, they've got 1 product approved to date. They've got 8 products in clinical development, 5 antibiotics companies that they're financing, and 1 is also into antivirals as well. 1 phage company, 1 diagnostic, and 1 antifungal. And that's sort of, that's the initiative here. And over here, which is sort of off radar for many people, we have a major malaria issue brewing in terms of artemisinin resistance. And there you've got companies like Novartis, GSK, Merck, all with compounds in mid to late phase development that address resistant strains. So there's really good activity going on the innovation stage. But I think when it comes to antibiotics, not enough. We need to go up a gear here, and that will require more investment. In terms of access, we haven't really launched many new antibiotics, particularly in LMICs in recent years. So I think there are 2 issues here. One is the access to the existing antibiotics and stewardship around those and ensuring there's appropriate infrastructure in place. And the other is then how we bring in newer modalities. And I think there's a good example of what can be achieved, again, through partnership with Shionogi, that is just making available now the antibiotic that was first registered in 2019. And so they've partnered up with GARD-P and CHAI, and they'll be making this available in 130 lower income countries through using tech transfer and generic manufacturing to facilitate that. So you can see all of the elements coming together. I think the final area of progress is one of the biggest conundrums we face is you have these antibiotics and you don't want to use them. And so what's the commercial model around that? And so there's some good work going into pull incentives from the UK government, the Japanese government, and we heard earlier about pilots from Canada, and a lot of the other OECD countries are looking at what can we do to create a model that will actually work and will incentivize companies big and small to get involved in this. So I can see a lot of good things happening here, but I still think there's a lot of glue needed to join this together. Thanks.
Thank you. And if I also want to pick up on the point that you raised around the supply chain and ensuring sustainable pipelines for antibiotics. Would you want to respond to that, Dr. Roth, again?
Yeah, no, so first, I think David has mentioned some of the good progress that has happened since 2016. So the last high-level meeting, we have a better pipeline, but we still. So we have more on the sort of supply side, at least early research, but we still do not have sufficient demand side mechanisms. So those are the pull incentives, those are the pool procurement mechanisms, those are the potential advanced market commitments, and also making sure that we actually do have mechanisms for ensuring generic access, so access to generics antibiotics in low and middle income countries. I think one of the learnings from the pandemic actually can potentially be used to boost this space a bit more. And to me, a really important learning is that we need more resilient supply chains. We need more diversified manufacturing, and we probably need more also regionalized responsibilities really for procurement and taking care of your population's health needs. I see an increased leadership politically from Africa, in particular on this account. Africa CDC is championing this together with heads of state. So why cannot we then now make sure to use antibiotics, antimicrobials as a case of pool procurement mechanisms across countries and governments? Because it's really about demand certainty. It's about ensuring that there will be high volumes used. And that's relevant for existing antibiotics. It's relevant then for both the branded ones and the ones that are now generic. And it's relevant, of course, to build that future pipeline. We know there's not insufficient political will, and just to be very honest on that, there are some pilots, but adding up the incentives are not sufficient. So we need then new partner or continue the partnership models we have, including the ones you mentioned.
Thank you. Dr. Reddy, can you just also build on that point as well about how can we, strengthen the capacity of low and middle income countries in order to increase equitable access of antimicrobials and vaccines, and just building that capacity on the ground in those countries? How would you, recommend that we do that? How is that possible?
Yeah, thank you. I think, John-Anna, your comments are really good, and I'm just going to build on those. So I think that as an industry, we're really supportive of mechanisms that consolidate demand and can lead to pooled procurement here because they give certainty. And that really helps companies. And just to reflect on one awful statistic really, and that is that I think it was between 2017 and 2023, there were 10 new antibiotics launched. 6 of those companies went bankrupt. Or were forced to be acquired because the model just didn't work. So getting this demand sorted in that regard, and then having the mechanisms, the pull mechanisms for the types of antibiotics you want to use really, really sparingly, that's one of the key challenges. I think also if you can have that type of pulled procurement, then you get efficiencies of costs, you get more affordable pricing, and this is something that the industry definitely is behind. And then also part of the mix can be local manufacturing and generics as well. And so I mentioned the example of Shionogi, but that's not the only example. What I think is sort of encouraging is that over the last 7 years or so, you've seen local manufacturing initiatives engaging industry through tech transfer in areas that go from COVID-19 to HIV, to HCV, to tuberculosis, polio, malaria, and antibiotics. So it's across the board, and I think this is building up capacity. So it's not a one-size-fits-all, but there's a number of different things we can leverage here to facilitate greater access.
Fantastic, thank you. Ashley, did you want to add to that as well before we take some questions from the audience?
Sure. I think we're talking a lot about new antibiotics and the access to them in low and middle income countries. But I also want to point out that very often in these areas, they are plagued both in animals and humans by infections that have been eradicated or under control in the global north. And so I think what's really important is that there's also struggling with access to vaccines for these particular infections. Also, the pathogens are different, and also in terms of anti-infectives to treat them. So I think that that's also another thing to consider, is that those infections that are also important are not being able to, you don't have access to that, let alone the new and access to it. And I think another important thing that we need to differentiate is that, yes, you need to have access in that it has to be available, but whether as an individual you can access it, that also needs to be distinguished a bit better.
Fantastic. So access at a regional level and access at a national level and also at the community level is key. Great. Do we have some questions from the audience? Yes. Let's go ahead.
Yes. 1, 2. Okay. Yes. Thank you to the panelists and the first and second panel for the excellent discussions. I just wanted to ask about the economic or the financial part, because I think, yes, we've been talking about political will, training, education. One thing I wanted to ask is, when we talk about diverse manufacturing from Nigeria, one of the challenges we have when we talk about is also cost, and the cost because a lot of these products are manufactured outside the continent. So how do we also diversify manufacturing, not only for antibiotics, but also for diagnostics? This is one of the big challenges. And also for the agricultural sector, we talk about the language, but the other thing driving the agricultural sector is the economics. So a lot of people want to make profit. And when they want to make profit, sometimes they use antibiotics because they do not have access to wash. So how do we also discuss with these farmers who are trying to make a living, and you're saying, okay, you need to do it this way, but they don't have access to those tools sometimes. So sometimes I think we are talking about behavior change, but we also need to also look at infrastructure, because sometimes we are just focusing on behavior. But if you don't have water to wash your hand, how do you change behavior?
Right. That's a good point. Does anybody want to
I can take the animal part. So for me, when I look at a reduction in use or prudent use, it's a pyramid. And in the pyramid, addressing use is at the top. At the base of it is very much about good animal husbandry practices, biosecurity, vaccination, and then use. And so what we really need to do is address that. But you're right, it's about understanding the motivators and the barriers within that system for that particular farmer to be able to make the right decision, the best decision. And if they don't have access to vaccination, I can scream myself blue and tell them they have to do that. If they don't have access to financing to improve biosecurity on their farms, it doesn't help. So I think it's what has been really important for me at ILRI and at the CG is understanding the context of those individuals who have to make the behavior change and what are their barriers, motivators, and how then can we leverage that to help them make better decisions. It's ongoing. I unfortunately have not cracked it yet, but we're working on it, and hopefully, together we'll have a better solution, at least on the animal side.
Fantastic, thank you.
I think that's a really important question, and it's, in a way, it illustrates the challenges because, in a way, the first investment should be sufficient infrastructure on WASH in all countries, of course. Where is the international fund for WASH? It's not in the room. And we have tended, in a way, to focus in global health on the global mechanisms that can ensure pool procurement, and we have had really important success on vaccines and vaccinations that has contributed to lower infectious disease incidence and therefore lower AMR burden, as Sally just mentioned in the previous panel. And similar, we had good outcomes on malaria, for instance, and we are in a much better position now on malaria resistance, even though it's increasing again. But I think this also speaks to the point that there will never be a big enough sort of AMR fund. There will not, even though there has been a commitment now to $100 million for the trust fund. So this needs to be integrated in the broader financing discussions, and that's back to the WASH question. It is about responsibilities for the domestic investments, infrastructure. Local costs should be the first priority, and then we should find ways and mechanisms where the international society can make sure that things can be produced at as low cost as possible, can be produced more locally in the larger schemes of things, and incentivize and also keep politicians accountable. We have. I will not single out any country, but you come from a country that also have a lot of resources, and it is about making sure that the tax to GDP proportion is as it should be, just to be very frank, because without ensuring sufficient public resources that can actually provide public goods like WASH and other infrastructure, it is difficult to not ensure a good health starting point for everyone.
Yes, please, ready, go ahead.
So look, thank you for the question, and just a point on the diagnostics. And the people in the room can correct me. I've got in my mind that the percentage of laboratories in Africa that actually have the microbiology facilities required is about 1.5%. And I'm looking at Dame Sally. We may not have the fact. So this is a real challenge. And I think one of the things is then you need to look and say, how can we leapfrog that? And if you look at diagnostic tests, we've got two challenges with us. One is the infrastructure they currently require, and the other is the timelines, which are just really unacceptable if you're treating a patient who has that type of infection. So rapid diagnostics are critical, but then if you're designing something new, think about the different environments it might go into, and that's the target product profile. So they shouldn't only be designed for the global north. And so I think if we get the target product profiles right, we build cost into our thinking early, heat stability, speed. It may be a tough challenge, but it's really one worth addressing, and we need to do that right from the beginning in R&D.
Fantastic. We have another question in the room. Go ahead. Question from the back. Go ahead.
Thank you. My name is Kate Harris. I'm a health financing consultant, so naturally my question is about health financing. I just wanted to break it down, the point on health financing with new and future antibiotics, and clearly there's a need for pull and push funding, which CARB-X and the AMR Action Fund are working hard on, and more to come. But I wanted to know about the access to current antibiotics. And we've heard in other panels today in the Global Health Lab that many antibiotics aren't available in many even high-income countries, let alone low and middle-income countries. And I wanted to ask the panel, what do you think is the health financing solution set there? Is there a need for a type of fund for existing antibiotics to ensure that there's better access there to fight infections, knowing that a lot of the financing, I think, has been talking more about future antibiotics? Thank you.
Dr. Reddy, do you want to take that, or anybody?
Okay. Thank you. Yeah, look, it's really good that you made that distinction, because I put it together in my response, and that's not appropriate. And so I think one of the key things is there is a lack of access to existing antibiotics. And so what we need there is a consolidation of demand and pooled procurement, very similar to what the Global Fund is doing today. If you had a global fund that was functioning in this area, it would look very different. Now, one of the elements of that is financing. But financing is only one element. We haven't got parts 1 and parts 2 of that addressed yet. And so I think that mechanisms that will allow us to do that demand forecasting and progress with pooled procurement, and then there can be, potentially there can be mechanisms then for looking at financing, but that would actually help address some of the issues of cost, because if you've got that consolidation, you can drive down cost and some of the uncertainty. So, I think the path is there before us. We've seen it work before. We don't have all of the ingredients here in terms of the financing. It's something that can be worked on, but this would make it easier.
Yes, please.
I guess I'm boring in that sense. It can be spelled in 3 letters and in 2 different ways. TAX, tax. I'd also already talked about tax, and then UHC. I think actually the major health financing for access to generic antibiotics is universal health coverage financing in countries. The global system can incentivize and support and contribute to that, but that's to me the only long sustainable goal. But then to help that financing sort of get to the demand signals that David and his industry needs, and also the generic industry needs, we need mechanisms to aggregate that health financing. We already have aggregation if you manage to do proper UHC in countries, but that's one country aggregation, in particular for smaller countries and for antibiotics that should not be used as first line, as David already mentioned. The reserve list or the aware list sort of antibiotics, they're most likely you would need pool procurement at the regional or sub-regional level. So definitely there are potential mechanisms, but those to me are not necessarily about financing, but about structuring demand. And also then, of course, it links to the Secure project, a collaboration with GARD WHO, working also on making sure that drugs are reaching the markets, getting approval. And then we have issues around regulatory reform, harmonization, labeling issues. It is quite expensive to have individual labels in all countries. Can we come up with more pragmatic solutions, in particular for pharmaceuticals, where maybe, in particular those that are not first line. Yeah.
Fantastic. Thank you for that response. We have one more question. Yeah. Sorry. I think we might.
Hi, this is Stanley from Singapore. The question is about data transparency. Earlier, there was a comment that was made. I'd like to understand from the public, private, philanthropic, as well as the scientific community, how can we improve data transparency? Thanks.
That's a tough one. I mean, as a scientist, and depending on where the funding is coming from, I have an obligation to make my data available. But that's my, when I'm in the Danish setting, as we are funded by the Danish taxpayers, and therefore that's the commitment that I make. On the other hand, in the countries that I work with in the Global South, we are running these projects in collaboration with the government, very closely with the government. And very often, the data that we find or we discover is maybe one that is not, they may not want to put in the public domain. And so therefore, it's a lot of, it's again, is it about the public domain that this data should be available, or is it transparency within other institutions working in the same space? And I think we have to delineate that. And unfortunately, it's a struggle I work with every day. But I wish it was more publicly available, but I can understand why it's not. And then the question is, how then do we work on that? And is that developing frameworks to work on data protection, data transparency? But I think a lot of it is also trust for that data sharing.
What kind of data are not available that you want to see available?
What
kind of data are we talking about that are key?
If you look at Animuse, for example, from WOA, that's not many countries have made their antimicrobial use in
utilize it,
yeah. And also AMR data as well.
Thanks.
So trust is always at the, is the bedrock of everything at the end of the day. Thank you for bringing that up. We have one more. No, actually, sorry. I saw this hand before, if you don't mind. Is that okay? I'm sorry. I just have to follow procedure. So maybe after him, we can take that question as the last one.
Thank you. I'm Stefan from Lecturio in Germany. I'm almost like in your blind spot, right? We need this little blinker you have on the car, a review mirror maybe. But thank you for noticing me. So I just wanted to make you all aware. So we're just finishing production on a EU-funded multiple European universities project called AMR Educare. So as you can guess, it's about education on antimicrobial resistance. The website is amreducare.eu. But the second reason I want to mention it and share it is if you want to drive a targeted intervention where you can track how people are actually taking it up and how that might be affecting prescribing effects in your region or things like that, then we can help with that. Then just come see me afterwards. Even though it's a European project, I don't mind. I'm happy to do this anywhere in the world at sort of our own cost, so to say. So if you want that, just let me know. Otherwise, you can see the contents going live in the coming weeks on that website that I mentioned.
Okay, so we'll take just that one question and we'll wrap it up. There was one question over there.
As the mic is going to Masika, I want to just point out with regards to education, very often when we look at antimicrobial stewardship in the animal health sector, it very often says a veterinarian is the one that should be consulted. And in low and middle income countries, the person giving animal health advice is not always a veterinarian. In fact, they're very far and few between. So I think we need to also understand that who gives advice can wear many hats and many titles, and therefore that education needs to be adapted to those individuals that are providing advice.
Thank you. So maybe 1 minute, if you can summarize the question in less than a minute, would appreciate that, because I know we're already running behind time.
Thank you very much. I think I'm amongst a few animal health practitioners in the room, and that's why my hand kept going up, because you're very few in this summit altogether. So my question is a comment and a question altogether for the two of you, except Ashley, because I know she deals with this a lot. I don't think the people in this summit understand the importance of animal health for people in sub-Saharan Africa. And I'll probably do what Githinji did in the first session. How many people are from sub-Saharan Africa here? I can bet that all of you are raised with an animal as a companion, as a source of nutrition, as a cultural component to it, as just a pride of having an animal in your boma, in your household, right? So when we are talking about the challenge of AMR and it being highest in sub-Saharan Africa or the global south, this is the second panel discussion that has really dived into animal health, and that is thanks to Ashley. The first one was on climate change at the beginning. So we cannot continue talking about LMICs and the global south, and we do not really tackle the issues that are really important at the global south. For instance, John, I don't think I've said your name correctly. When you are caring for the women in Cape Verde or Sao Tome and Principe about their health, if you do not care about the animals within their compound that they depend on for food, for nutrition, for independence, because this woman will sell the goat to be able to buy sanitary towels that you're preventing them from getting sick to get to the hospital. You really are not catering for the health of these people. So how do we make sure that next year when we're coming to the World Health Summit, we're not begging for animal health to be part of the discussion? We are not having only 2 panel discussions talking about animal health. We are not having panelists just mentioning animal health as a by the way. We are not having One Health as a greenwashing term that people are using to continue with the next discussion. I am getting a bit tired of elevating the topic of animal health because I am here very well educated because of animals. My father is a farmer. If it were not for animals, I wouldn't be here, and many people here would not be here because of animals. So for John and David, how do I get animals on your table? Not in terms of food.
Thank you. Thank you for that question. And I think that's the perfect last question, right? So, Dr. Roth, again, if you want to take that, I think it would be good.
Animal health is really key. And I worked every summer in my grandfather's farm with 3 milk cows, 13, sorry. So I know a lot about animal health and the need for small farmers, even in high-income countries, to keep their herd healthy. When I'm concerned about the balance in agriculture sector, it's not really about the misuse of antibiotics in small-scale farmers in Africa. It is about big food. It is about big food on several continents and making sure that they are accountable, they are transparent, and they are willing to engage in proper animal welfare, because that's the starting point for ensuring animal health, and not substituting proper animal welfare by using antibiotics, antimicrobials to treat herds that are unnecessarily becoming sick, and definitely not using antimicrobials or antibiotics as growth promotion. That has nothing to do with animal health. It's not healthy for those who eat those animals, and it's not healthy for the animals. So I fully agree with you. Animal health is an important part of it. But I think the hard discussion is with the big food companies.
Thank you. Okay, Ashley, you want
Can I just quickly, I know I wasn't supposed to say anything, and thank you so much, Masiko, for that. I think one of the things, we spoke about One Health, one budget. But one of the things we're piloting in the Horn of Africa is One Health units, specifically addressing where we come to you, we talk about human health, vaccinations of your children, but we're also bringing animal health and environmental health. So these One Health units are another way of delivering health for all the sectors to the people who need it. So I think it's that packaging that's quite important and cost effective as well.
Thank you. And we're at time, but I want to give David the floor for 1 minute.
Yeah, clearly there's an interplay between the pharmaceutical industry and the animal care industry. In fact, some of our companies have both divisions. Unfortunately, I'm not from the animal care division, so that kind of limits where my expertise is in the discussions, but I agree with you. It is absolutely critical this is brought together in the discussion, or we won't make the progress we need to make in AMR.
Thank you. And with that, we've come to the end of today's keynote session. Thank you so much for your time, and enjoy the rest of the conference.